morning. Today we will learn points of Taiyang Meridian. There are 38 points of the small intestine meridian, 19 on each side, 4 on the head and neck, 7 on the shoulder and back, and 8 on the lateral aspect of the posterior upper limb. The points of this meridian treat disorders of the small intestine, heart, chest, throat, neck, face, 5 sensory organs, and the running course of the meridian. Small intestine 1, 少泽. It is the 颈 well point. 少 means small, 泽 means moisten. The Taiyang meridian governs thick fluids that have the function of moisturizing the body. The 颈 well point is where the meridian qi begins. Thus, it is called 少泽, small marsh. Location: on the little finger, ulnar to the distal flanks, 0.1 cun, proximal medial to the ulnar corner of the little fingernail, at the intersection of the vertical line of ulnar border of the nail and the horizontal line of the base of the little fingernail. Indications: first, headache, superficial visual obstruction, sore and swollen throat. Second, mastitis, insufficient lactation. This function is quite special. Why? The little finger is the junction of the small intestine meridian and the heart meridian. Heart governs blood. Blood provides nutrients to breast milk, and if blood is insufficient, there will be insufficient lactation. Breastfeeding mothers may have mastitis with syndromes of breast lumps, less milk discharge, and swelling and pain. Stimulating this point can open and smooth the clitoris to dredge the obstruction of the breast so that the qi will flow and the blood will be activated and the patient can produce more milk and clear away heat and dispel stagnation, and the swelling and pain will disappear. Third, febrile disease, fever, unconsciousness. As all the Jingwell points, it can wake up the brain and open the orifices. Manipulation. First, needle shallowly 0.1 to 0.2 cun to induce distension at the local region, or bleed with the 3-edged needle. We should take special care when treating pregnant patients. Small intestine 3, 后溪. It is the shoestring point and also a confluence point of the Du-mai. 后 means behind or posterior. 溪 means stream. Where the loose fist is made, it is located at the ulnar end of the transverse crease, which is shaped like a stream, so the point is named posterior stream. Location: on the dorsum of the hand, in the depression proximal to the ulnar side of the 5th metacarpophalangeal joint, at the border between the red and white flesh. Indications: first, headache, painful and stiff neck, lumbar pain, pain in the elbow and arm. As it is the confluence point of the Du-mai, Du-mai past the neck and back. Second, deafness, red eye, nasal bleeding. Third, Du-mai is related with brain, so it can be applied in depressive and manic psychosis, epilepsy. Manipulation: needle 0.5 to 0.8 cun perpendicularly. Deep insertion can penetrate large intestine 4, 合谷, small intestine 4, 腕谷. It is a yuan source point. It is located in the depression inferior to the pisiform, so it is called 腕谷, wrist bone. Location: on the posterior lateral aspect of the wrist, in the depression between the base of the 5th metacarpal bone and the triquetrum bone, at the border between the red and white flesh. Location method: with one finger placed on small intestine 3, push and slide proximally along the 5th metacarpal bone to the bony projection. The point is located in the depression between these two bones. Indications. First, headache, painful and stiff nape, pain and limitation of motion in the shoulder, arm, and wrist. Second, optical nebula, tinnitus. Third, jaundice. Fourth, fever, infantile convulsion, hyperspasmia. Manipulation, needle 0.3 to 0.5 cun perpendicularly. Small intestine 6, 养老. This is the C-cleft point. 养老means caring for the elderly. The point was given this name because it treats age-related ailment such as deafness, blurred vision, and shoulder and arm pain. Location on the posterior lateral aspect of the forearm, in the depression radial to the head of the ulnar bone, 1 cun proximal to the dorsal wrist crease. Location method: with the palm facing downwards, press the highest point of the head of the ulnar bone with a finger, and then turn the palm towards the chest. The point is located at the cleft between the bones where the finger slides. Indications. First, blurred vision. Second, numbness and pain in the shoulder, back, elbow, and arm. Stiff neck. Acute lumbar pain. Manipulation. Needle 0.5 to 0.8 cun obliquely upward. The patient should experience soreness and numbness at the wrist that can radiate to the shoulder and elbow. Small intestine 7, 支正. This is the lower connecting point. 支 means collateral. 正 means main meridian. This is the lower connecting point. The main meridian branches here and enters the 少阴. Thus, the point is named 支正, collateral branch. Location on the posterior lateral aspect of the forearm, between the medial border of the ulnar bone and the flexor carpi ulnaris muscle, 5 cun proximal to the dorsal wrist crease. Location method. The point is 1 cun distal to the midpoint of the line, connecting small intestine 5, 阳谷, with small intestine 8, 小海. Small intestine 5, 阳谷, Yang Valley. It is the Jing River point. It is located on the posterior lateral aspect of the wrist, in the depression between the triquetrum bone and the ulnar styloid process. Small intestine 8, 小海. This is the Hershey point. The Chinese meaning small c. It is located on the posterior lateral aspect of the elbow, in the depression between the olecranon and the medial epicondyle of the humerus bone. Indications. First, headache, stiff neck. Second, fever, depressive and manic psychosis. As a lower connecting point, it also can treat heart-related mental problems. Third, pain in the elbow and arm. Manipulation, needle 0.5 to 1 cun, perpendicularly or obliquely. Small intestine 9, 肩针. 肩 means shoulder, 针 means directly or upright. It is located below the shoulder, directly above the posterior axillary fold, so it is named 肩针. Location on the shoulder girdle, posterior inferior to the shoulder joint, 1 cun superior to the posterior end of the axillary fold. Location method. When the arm is abducted, the point is located 1 cun superior to the posterior end of the axillary fold, posterior to the deltoid muscle. Indications. First, shoulder pain, paralysis of upper extremities. Second, scrofular. Manipulation, needle 1 to 1.5 cun obliquely toward the back. or insert toward the anterior axillary crease to produce soreness and distension at the shoulder and the scapula. Small intestine 11, 天宗. 天 means upper region or heaven. 宗 means center. Because the point is in the center of the inferior scapular fossa, it is named 天宗, center of heaven. Location: in the scapular region, in the depression between the upper one-third and the lower two-thirds of the line connecting the midpoint of the spine of the scapula with the inferior angle of the scapula. Indications: first, scapular pain, limitation of motion in the shoulder. Second, acute mastitis. Third, asthma. Manipulation: needle half to 1 cun perpendicularly or obliquely to produce local soreness and distension or induce the needling sensation to radiate from the scapula to the fingers. Small intestine 18, 全髎. This is an intersecting point of Han Shaoyang and Han Taiyang meridians. 全 means cheekbone. 髎 means crevice beside the bone. This point is named 全髎, cheekbone crevice, for its location at the inferior border of the zygomatic bone. Location: on the face inferior to the zygomatic bone, in the depression directly inferior to the outer canthus of the eye. Indications: first, facial palsy, twitching of the eyelid. Second, facial pain, toothache, cheek swelling. Third, red eye, blurred vision. Manipulation: needle 0.2 to 0.3 cun perpendicularly. To remove facial wrinkles, warm moxibustion may be administered until the skin is warm and comfortable. The last point, small intestine 19, 听宫. This is the intersecting point of the hand and foot Shaoyang and Han Taiyang meridians. 听 means hearing. Gong is the chief of the 5 tones. This is an important point for treating ear disorders. It is named 听宫, main point for hearing, to imply that it can help one hear the 5 tones. Location: on the face, in the depression between the anterior border of the center of the triggers and the posterior border of the condylar process of the mandible. Location method: with the patient supine and the mouth slightly open, the point is in the depression anterior to the center of the triggers, between 三焦 21 耳门 and gallbladder 2 听会. Indications: first, tinnitus, deafness, autopyria, toothache. Second, depressive and manic psychosis, epilepsy. Manipulation: needle half to 1 cun perpendicularly with the mouth open to produce local soreness and distension. Precautions: avoid deep insertion, which can injure the neck artery and vein. Direct moxibustion is not suitable. A 46-year-old woman suffered from tinnitus and deafness for 2 weeks. In recent 2 weeks, the patient gradually developed symptoms of tinnitus and hearing loss in right ear. She felt the sound of the tinnitus from high to low, accompanied by dizziness, dry mouth, and bitter taste. His appetite is normal. Urine and bowel movement are normal. He has pale tongue with light white coating and red tip, string and slippery pulse. Diagnosis: tinnitus, Shaoyang meridian obstruction. Treatment should be regulating the meridian and unblock Shaoyang. Use reducing manipulation after needling on small intestine 19 听宫, 三焦 17 易风, 三焦 3 中主, large intestine 4 合谷, and liver 3 太冲. Give treatment every 1 week. After 3 treatments, tinnitus relieved, hearing slightly improved. After 10 treatments, the patient felt all syndromes improved. Totally 20 treatments later, all the symptoms disappeared. Let's summarize the special function of small intestine points. To treat insufficient lactation, small intestine 1. For neck stiffness, pain of the lumbar and back region, night sweats, small intestine 3. Mastitis, panting, small intestine 11. That's all for today. Thanks.